I can confirm we have 41 new cases of coronavirus in the last 24 hours in Victoria. That takes us to a total of 1,987, which is an overall increase of 40. One case was reclassified yesterday during investigations. Of those 41 at the moment, 8 we know are linked to outbreaks. 1 is detected in hotel quarantine. A further 13 have been detected through routine testing. So as yesterday, they're not in hotel quarantine, but they may well still be linked to outbreaks as investigations continue. And another 19 are under investigation. We currently have 260 cases that indicate they are community transmission. We don't have a clear source for those cases, so that's an increase of 15 since yesterday. We have 204 active cases in Victoria. 5 of those are in hospital and 1 of those 5 is in intensive care. 1,761 have recovered and we've had no further deaths from coronavirus in Victoria. Total of 758,672 tests have been received, which is an increase of over 21,000 since yesterday, which is really pleasing to see that so many people are getting tested. In fact, it's closer to 22,000 since yesterday. In terms of other news for today, we will be sending and have already started sending an emergency alert to residents of the suburbs of Keillor Downs and Broadmeadows. So as part of the blitz, this alert has been issued to let communities in those hotspots know that there are testing vans, there are door knockers and expanded community engagement teams in their area and to please get tested. If people would like to see an example of that text message, it's up on the Emergency Victoria website, but I believe multiple media outlets have already put pictures up of that so that people can confirm that is the correct message, and we encourage people in those areas to continue to go and get tested, and for those hotspot suburbs, that testing continues to be available for people who are symptomatic and asymptomatic, and for the rest of Victoria the message really does remain: if you are symptomatic, please get tested straight away in any one of our testing centres through your GP or through other respiratory clinics at hospitals or other general practice settings. So I'll leave it at that and take any questions.
Are we, in those cases, are we starting to see the results from the suburb by suburb testing yet, or not yet?
Some of them will be from the suburb by suburb testing. We had been standing testing sites up in those suburbs throughout the week. Obviously the big blitz started on Thursday with community engagement and people knocking on doors, but activities had really started from Sunday and Monday of last week, so some of those will be due to that. I don't have an exact number of how many of the overnight cases are symptomatic or asymptomatic due to the blitz, no.